Hi, hello everyone. So let's grab a CT scan from the emergency to read, because as you guys know, CT scans just won't report themselves. So this is a 55-year-old male patient, and this is a pulmonary artery angiogram because it says this patient might just have a acute thrombosis. So it's downloading quite fast, less than 1 minute to go. Let's grab ourselves a template for this exam. I have templates for every exam and some variations to make it easier and faster to report. It's done. Let me just share my screen so you guys can actually see the images as I roll them. So this is it. I'll grab the angiographic phase. Let's roll. And I'll roll up and down so you guys can enjoy the images, and I'll just keep quiet to see if you guys can notice if there is disease or if this is a normal exam. What do you guys think? Leave in the comments below. Is this a pathological exam or yet another normal exam? And when you go down to the comment section, don't forget to hit that like button and consider subscribing to the channel. So what do you guys think? I'll just hit an NPR button so nobody complains that I'm holding back on information. See, is there any signs of acute thromboembolism of the pulmonary arterial circulation? Leave in the comments below. I'm going to put a sagittal NPR, a sagittal reconstruction. Is there any sign of acute thrombosis? And the answer is yes. This is a massive, huge, extremely severe case of acute thrombosis. See, this is a filling defect, a irregular acute filling defect all over the arterial circulation, starting off the main pulmonary arteries, both left and right, and going into the lobar, segmentar, and subsegmentar or segmentary branches, primary, secondary, tertiary, and so on and so forth. Segments, branches of those arteries. Right here, as you guys can notice, the vessels are enlarged and filled up or partially filled up with contrast, and wherever isn't filled, it's actually black or dark, irregular, with acute angles towards the borders, the inside borders of the vessels, which tell us this is real acute pulmonary thrombosis. So this is a massive, extremely dangerous and life-threatening disease. So let's be quick. Let's report it as fast as we can as a very, very severe case of acute pulmonary thrombosis. So I'm just going to say that the main pulmonary arteries present themselves with normal sizes and trajectories and morphology, and there is acute thrombosis all over the place. Let's just sign it off and move to the other exam. So if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and keep watching. And until next time, I'll see you around.